watching Let's Chat.
Welcome back, everyone. October is Breast Cancer Awareness Month. We are learning more about women's health and why it's so important to get your mammogram. And joining us now is Dr. Todd Cockerham with Erlanger Health System. Good morning, Dr. Cockerham.
Good morning.
Thank you for joining us. First of all, let's talk a little bit about Breast Cancer Awareness Month. There are so many women impacted and men by this devastating disease right here in the Tennessee Valley.
Yes, and it's something that the screening is very important. There are over 250,000 new breast cancers diagnosed every year, and then there's another 50,000 of non-invasive breast cancers that are also diagnosed every year. The screening is very important because that's the way majority of these breast cancers are diagnosed.
Tell us a little bit about the screening process for women. What should they know? A lot of women are fearful sometimes to just go. What information do they need to know? It's so important for your body as a whole to make sure that you're doing this at least once a year. If you're over the age of 40, correct?
Correct. We recommend for women that don't have a significant family history to begin their screening at age 40. The screening process is generally painless. I think some women have a significant fear that it's going to be a painful process. They certainly have improved that process over the last several years. I also think it's quite a bit quicker than it used to be.
Let's talk a little bit about being high risk. What should a woman know, and how do they fall into that category? And should they go earlier for their screenings?
Well, the majority of women that are high risk know that from their family history. So if you're aware of close relatives, sisters, mothers, grandmothers, even fathers that have had breast cancer, then that in general puts you in a high risk category. Those women usually, if they're found to be in high risk categories, will get their first screening done at the age of the diagnosis of their youngest relative.
Good information there. Now, what happens if a woman gets back an abnormal mammogram? Walk us through the process there. What is the next step for them?
So then they'll get what's called a diagnostic mammogram, which is a little more comprehensive mammogram. They'll take different views, they'll magnify it, and they will probably end up with an ultrasound as well.
Let's talk also a little bit, if folks would like some more information, how important it is for them to get their mammogram and learn more about the breast health. What can they do, Dr. Cockerham?
Well, a lot of times they can just go talk to their primary care physician or whoever has referred them for the mammogram. From a surgeon standpoint, we'll see them if their mammogram is abnormal. A lot of times we'll see women that have a mammogram that may not need a biopsy but needs to be followed.
Dr. Cockerham, have you seen an increase over the last few years of more and more women coming in and you're having to do surgeries?
We're seeing more women that are diagnosed. The diagnosis rate is going up, and some of that is probably due to better screening techniques. The imaging is much better than it used to be, and so I think we're finding cancers at an earlier rate. The overall incidence of breast cancer is slightly increasing every year,
which is very sad. You know, we are so thankful for many doctors like you that are helping so many folks right here in the Tennessee Valley as they struggle and go through this. But luckily, there's great information out there, also provided by Erlanger Health System. Again, if they would like some more information about women's health, how can they get that, Dr. Cockerham?
Once again, they can contact their primary care physician. They can contact Erlanger, which has a comprehensive breast center, and they can also contact our office.
All right. Thank you, Dr. Todd Cockerham, for the information this month. Again, this is Breast Cancer Awareness Month, so please get out if you're over the age of 40. Get your mammogram, get checked, and go to your gynecologist every once a year and make sure that you're doing the right things to help keep you safe, your family safe, and just take care of your loved ones. Again, we'll be right back after this short break.